Alexander. Regarding your questions, I do agree with you that all members of the healthcare team should be trained to address and provide spiritual care. I think it's important that all members be trained in this because you were all providing different areas of treatment for this client, but you all spend different amounts of time with them. You were there for different things and you were all trained in different things, so the relationship you have with that client may be different than from the nurse to the doctor to the OT to the PT, so they may be more comfortable to talk to one of you versus the other depending on what they're familiar with. So if you are the one person that they want to be addressing with it, you need to be comfortable in being able to address this with them. I do feel like as OTs, we kind of really emphasize more of a holistic care than some of the other medical professions. So we look at the psychosocial, we look at the spiritual issues. So I feel like this is something that maybe OTs could help other medical professions learn how to address better. As far as your other question regarding guidelines, I do think that there are many guidelines that do address the psychosocial issue, which kind of breaches into the spirituality assessment, but I think that there is more that could be done, and the book kind of recommends that you need to really talk with the patient and figure out what they want, so not what you want, what the book wants. I think this is really important, and I think a key for us as medical providers would be to be open. Being open with your patients, being able to have conversations that you may not feel comfortable with, but they're comfortable with, can help. And as you kind of stated, I think if the doctor from the video that we watched was more open to having these conversations, then maybe Sarah could have spent her last few weeks here on Earth having more productive and better time and being able to take care of her newborn child. Thanks for the comments.